Welcome. Today, you'll learn the essentials of infectious disease disposal, ensuring safe handling and disposal of hazardous materials to prevent the spread of illness. Put on disposable gloves, a face mask, and a gown or apron before handling any infectious waste. This protects you from direct contact with potentially harmful pathogens. Identify and separate any materials or items that have come into contact with infectious agents. This includes used tissues, bandages, contaminated dressings, gloves, or any other disposable items used during the care of an infected person. Also, put the infectious waste into biohazard waste bags. These bags are made to safely hold and move hazardous materials without any risk of leaks or contamination. Once the biohazard waste bags are filled, securely tie or seal them to prevent any spills or leaks during handling or transportation. Clean and disinfect any surfaces or areas that have been in contact with infectious waste using a suitable disinfectant solution or wipes. This helps to kill any remaining pathogens and reduce the risk of transmission. Grab wipes and clean the highlighted area where the waste was located. Follow local regulations and guidelines for the proper disposal of infectious waste. This may involve placing sealed biohazard bags into designated containers or arranging for their pickup by authorized waste management services. Carefully remove and dispose of disposable gloves, face mask, and gown or apron. Avoid touching the exterior surfaces of these items to prevent contamination. Dispose of your disposable gloves, face mask, and gown or apron in the designated container. Wash your hands thoroughly with soap and water for at least 20 seconds after removing protective gear. Alternatively, use an alcohol-based hand sanitizer to disinfect your hands. Keep a record of the types and quantities of infectious waste generated, as well as the disposal methods used. This documentation may be required for regulatory compliance or monitoring purposes. Dispose of used personal protective equipment, PPE, in accordance with local regulations. Some items may need to be placed in designated PPE disposal bins or containers. This has been a demonstration of proper infectious disease disposal procedures. Feel free to review the steps again or return to the main page to explore other topics.